most famous physical therapist on the internet.
Hi, folks. I'm Bob Schroep, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about one bad habit that may be causing your knee or foot pain
Sure.
and how to fix it. But by the way,
yes.
if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to go to our website, bobandbrad.com, but go to the giveaway section because we're always giving something away.
Yes.
Right now, we're giving away the massage pillow. Really cool thing. Brad's going to demonstrate it real quick.
There it is. I've been enjoying it for the last 5 minutes, and it's heated, and it rolls, and it massages those back muscles very well.
Yeah.
I want to get back on it.
Very reasonable price, and they often have a coupon along with it. So we'll have a link down below for that.
But you can win it for
yeah, you
nothing.
can also, I think we're giving away 3 of them or something like
Sure.
that. Go to Facebook. It's also pinned to the top of the page there. You want a shorter version of us, go to Instagram or Twitter. We got a 60-second version of our program every day. So when you, let's go right to it, Brad.
That's right.
When you stand or walk with your knees basically too straight or hyperextended. So if you stand all day long with your knee hyperextended like this, that's going to cause problems. One thing that happens with this, Brad, is that over time, the calf muscle starts to actually get a little tight because this is stretching it. This is keeping it straight, and so it can actually tighten up on you. But why is the knee straightened bad? We're actually going to demonstrate this right now.
Sure.
So in your knee joint, you have cartilage or the kind of the cushioning of the knee. And so this peanut is going to represent the cartilage.
Sure.
So we're going to put that in there. And you can see if the knee is straight, we're fine, right? If you have a little bit of a bend in there.
Yeah.
But let's say you stand all day long with the knee hyperextended.
Oh.
Yeah. So in other words, you're putting a lot of stress on that cartilage.
Right. It sounds like the joint is cracking, or that we call it crepitus. Oh, Bob. Why, Bob?
Why? Sorry. Now I got to finish eating my peanut butter.
Yeah.
I used to stand like this, Brad, so I'm very well aware of this. And I used to stand with this knee, my knees hyperextended. And what happens over time, it actually starts to stretch out.
Sure.
And it was starting to hurt me even when I was doing athletic events. Like also my knee would give way because it would stretch out.
Yep.
But I was treating one patient. He worked at Subway. And he stood like that all day long.
Yep.
All we had him do is change that. Have him stand with a staggered stance.
Yep.
With a little bit of a bend.
Yep.
And his knee pain went away. But there's a lot of people that I've told them to stop doing this, and I'll watch them. They keep doing it. It's a very difficult habit.
Well, it's a habit. It's their body's used to it, and it's just normal. And your nervous system, it's that proprioception needs to be reset.
So we have a little way that you can actually teach yourself not to do it anymore.
Sure.
So all I did is I took some tape and I ran along the back of my leg with the knees slightly bent, or with the knee bent actually. And now anytime I try to straighten this side, it pulls on the skin.
Especially if you got hairy legs.
If you got hairy legs, it'll even do better. We actually use this, what is it, like a coverall? It's a tape that's you use underneath other tape.
Right. But you could use
any tape.
Athletic tape would probably be a good thing.
You could use even Scotch tape.
Sure.
Probably.
What about duct tape?
Duct tape would work.
I don't know about that.
Yeah, that might be a little hard on the skin. But yeah, this will teach you. This will teach you that you shouldn't be walking or standing that way. But furthermore, you shouldn't also walk that way. I had one lady just recently. She'd stand like this and she'd take her step like this and hyperextend or extend the knee when she's walking. What that does, the heel is going to hit very harshly.
Yep. So he's talking the heel strike right there.
And it's going to send forces up through the leg, and it's going to put more stress on the knee when you're walking. But it's also going to put more stress on the bottom of your foot. So what we're trying to teach you, like if you have plantar fasciitis, this is something you'll want to learn. You don't want to, when you want a heel strike, you want to strike the forefoot and the heel at the same time.
Right.
Or at least 60-40.
So, to make it clear, he's really dorsiflexor. The toes are up, and this is very common for some people, which makes the hyperextension
Yep.
exaggerated. And like Bob said, the plantar fasciitis takes more stress.
Yeah, the plantar fascia is a thick band underneath the foot in
Yep.
the arch of the foot, helps keep the arch like in its
Stable.
shape and stable.
Mm-hmm.
And this puts a lot of stress on it.
Yep.
What you have to learn to is to take probably shorter strides to start off with,
Right.
and you're going to try to hit the heel and the forefoot at the same time. Brad and I have talked about this quite often with running.
Right.
So if you were a heel runner, you wanted to go to more of a forefoot runner.
Right.
So when people are starting to learn this, quite often the sensation is almost like they feel like they're falling forward.
Right.
Because I'm taking a step forward. Look at me, how I'm falling forward. You're actually kind of leaning the body forward a little bit too when you're walking.
Yeah. And don't get that mixed up with that. Sometimes you'll see people really walking forward. It's just you really don't see it, but you feel
you're
it.
kind of leaning forward like this. But you can see I'm hitting the forefoot and the heel at the same time, or nearly at the same time. And that's going to put less stress on the knee and less stress on the foot.
Sure.
And you may think that this is a minor thing, but it's not, with the number of steps you take each day. And the same thing, it's not a minor thing when you stand with the knee extended like that all day long. It's just another thing that's going to put a lot of stress on the knee.
Yeah, we want to keep those knees as healthy as possible, as long as possible, and stay away from those replacements.
Right. So anything else you want to add to this, Brad? You want me to crack some peanuts for you?
No, I'm fine. Sam is fine, and that would make a pretty good peanut cracker, though, for a Christmas gift. We could come up with some.
That's right. There we
That's
go.
a neat idea.
Walnuts and peanuts. I'm sure we can crack them all. So remember, Brad and I can fix just about anything
except for
a broken heart.
But we're working on that.
Yep,
We'll get
even
right
if
in there and do the heart
it's in
massage.
Sam's heart. Yeah. Thanks for watching.